The partial thromboplastin time or activated partial thromboplastin time is a performance indicator measuring the efficacy of both the intrinsic and the common coagulation pathways. Apart from detecting abnormalities in blood clotting, it is also used to monitor the treatment effects with heparin, a major anticoagulant. It is used in conjunction with the prothrombin time, which measures the extrinsic pathway. Kaolin cephalin clotting time is a historic name for the activated partial thromboplastin time. Method: blood samples are collected in tubes with oxalate or citrate to arrest coagulation by binding calcium. The specimen is then delivered to the laboratory. In order to activate the intrinsic pathway, phospholipid, an activator, and calcium are mixed into the plasma sample. The time is measured until a thrombus forms. This testing is performed by a medical technologist. The test is termed partial due to the absence of tissue factor from the reaction mixture. Interpretation: the typical reference range is between 30 seconds and 50 seconds. Shortening of the PTT is considered to have little clinical relevance, but some research indicates that it might increase risk of thromboembolism. Normal PTT times require the presence of the following coagulation factors: I, 2, V, VII, 9, X, 11, and 12. Notably, deficiencies in factors 7 or 13 will not be detected with the PTT test. Prolonged aPTT may indicate use of heparin, antiphospholipid antibody, coagulation factor deficiency, sepsis, coagulation factor consumption, presence of antibodies against coagulation factors. To distinguish the above causes, mixing tests are performed, in which the patient's plasma is mixed with normal plasma. If the abnormality does not disappear, the sample is said to contain an inhibitor, while if it does occur, a factor deficiency is more likely. Deficiencies of factors VII, 9, 11 and 12 and rarely von Willebrand factor may lead to a prolonged aPTT correcting on mixing studies. History: the aPTT was first described in 1953 by researchers at the University of North Carolina at Chapel Hill. References